Welcome, everybody, to The Art of Healing with your hosts, Dr. Judy Jasek of Animal Healing Hearts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Happy to be here, and I love this topic for today. And turns out you have a personal experience with your pets to support what we're going to be talking about today.
Absolutely. We took Mr. Cha-Cha in yesterday. He is a 9-pound Chihuahua, and he's 16 years old now.
Wow.
And we just initially started to notice a couple months ago, his breath was terrible. I mean, you could tell something was not going well. And when he allowed us to actually take a look in his mouth, and when I say allowed, I'm going to put that under big quotes, is he will bite you and he will attack your hand if you get close to his mouth. So it's really kind of a hit or miss, and it was tough to find. But when we took him in yesterday, they had to do a very extensive surgery on his mouth because, as the doctor said, some teeth were rotted out. And we feed Mr. Cha-Cha raw. I mean, we go 100% raw. But he goes, the doctor couldn't explain, because he had never seen it before, why some teeth were in wonderful health that required no cleaning, and some teeth were rotted out and were really, really bad. He goes, usually you see everything is like middle of the road. So I wonder if he got an infection way back when in his mouth, and that caused those other teeth to rot. So yesterday we took him in for surgery. He's recovering now, and he did great through it. And the doctors all said he is really, really healthy. So that is great to hear too.
Yeah. So he'll have nice clean teeth to bite you with now.
That's right. So well said. And we're kind of anticipating to be bit with those nice, new, fresh, clean teeth.
Yeah. But he'll have better breath. So,
yes.
You know.
So let's talk about dental care today.
Yeah.
And, in preventing it and talking about what we could do around it. So what are your ideas around dental care?
Yeah. Well, I think, Mr. Cha-Cha is a great example of why we need to get our pets in for a proper dental evaluation, because there can be so much hidden disease that even surprises the dental specialist. You took him to a veterinarian that specializes in dental care, which is what I recommend doing. I actually need to get one of my little kiddos in. I need to make an appointment to do that same thing, because you can look, I've looked in thousands of pet mouths over the years, and I've been fooled. And I know when we have odor, like just bad breath that just won't go away, especially when you're feeding a raw diet.
Yep.
And we'll talk about diet more too, and some myths there. But if there's persistent bad breath and even behavior changes, so infected teeth hurt, and these tooth roots, which I'm guessing that's what Mr. Cha-Cha had, was infected tooth roots.
Oh,
you can't see those from the outside. You have to get in and get those x-rays taken, and you will not know. And these are painful, and pets can have extremely painful teeth. And you're not going to know it, and I've heard this story so many times. Older pet, they're losing energy. They're just not doing the things they used to. Their pet parent thinks, they're just getting older. Then they go in and get the dental work done, get the x-rays taken, get any painful teeth extracted. And all of a sudden they're like a new dog, and they're playing with their toys again and doing all these things that they just written off to old age. So infected and diseased teeth are painful. And this is one of the reasons why I am not a proponent of the anesthesia-free cleanings. Or if you're going to do that, you have to understand the limitations. There's as much or more tooth mass below the gum line that you can't even see.
Okay.
And you're never going to see that without x-rays. So there's so much going on that you'll never see. And if you just scrape the tartar off the outside of the teeth, that is doing nothing to help with, keeping the roots healthy, and you just won't know. So a dog could have a painful tooth, an infected tooth root. And if you're not getting in there and doing the x-rays, which does require general anesthesia, there's just no way to get x-rays taken without it. And I know a lot of people are hesitant to do the anesthesia. This is another reason I recommend go to a dental specialist, because they anesthetize all of their patients, and they always have somebody dedicated to monitoring anesthesia. And they have the latest protocols and all the equipment to make anesthesia as safe as possible. And it's so important for the quality of life of the pet to get them in and get this taken care of. If anybody that's ever had a toothache, I know I have, and man, your whole head throbs. So you can imagine your poor pet, if they have an infected tooth and you don't know it, and all of a sudden they're not wanting to play with their ball or go for walks. Well, it's because they hurt. And it's sad to think that could be going on. And it's something you can completely help with a proper dental procedure.
Yeah, absolutely. I mean, it was interesting when they looked at his mouth yesterday. Like I said, they said they found multiple infected teeth in the back, which we don't know. I mean, we look at it, but I know, you had mentioned with your own dental pain, if you have an infected tooth or anything like that, how it just takes over your life. It's all you can think about. So you started to point to some, behavior issues that may happen under that extreme amount of pain. So if you have a dog that's just being just aggressive a little bit, acting a little bit funny, could it be down towards that road of dental pain that you don't get to see that there could be something going on?
Sure. Or not wanting to have their mouths touched. Now, Chihuahuas, that's kind of, they're notorious for not wanting to have their mouths. I have two of them, so I know all their little idiosyncrasies. I'm not being, judgmental. I live this Chihuahua thing, and they are sensitive about their mouths. But if your dog all of a sudden, like say your dog has bad breath, you want to go get a look in the mouth, and they just will not let you touch it, or they're more sensitive on one side than another. And you can just, even kind of push on the outside and see if there's any ouchy areas. If they chew on things like bully sticks or tendons or some of these chew toys, do they always chew on the same side? And what happens oftentimes is if like one side is a lot worse, like one side of the mouth has a lot more tartar, it's because that side is painful and they're not chewing on that side. So if they have a bully stick or even just eating their meals, they're not going to be chewing on the side that hurts.
That's a really good point. And I wonder, with all the bones that we were giving him, was he naturally just going over to that one side of his mouth thinking, well, if his teeth are fine, he's eating bones, he's eating a hard object and scraping, his teeth on it. Could he be okay under that? So now you talked about where individuals do anesthesia-free teeth cleaning. And you don't think that it really has the validity, because unless they can x-ray and get to that root of the tooth and see if it's infected or not, it really is just polishing them, essentially making them look pretty.
It's purely cosmetic. So for like a very young dog that's just starting to get a little tartar, you want to get that off the teeth. They're 2 to 3 years old. Chances are good that dog is not going to have any serious disease down in their roots. Sure. Or dogs that are, like older dogs that are just not healthy enough for the anesthesia, they might be a candidate. My concern there is that older dogs are the ones that are more prone to having these infected tooth roots, and you go poking around in there. Again, if you've ever been to the dentist and they're cleaning your teeth and they hit a spot that kind of zings, boy, it hurts. And, the dogs can't tell you when something is hurting them. And so, a lot of older dogs have receding gums and other, inflamed gum, infected roots, all these things that we're talking about. And you could be just going in and aggravating and creating more pain and discomfort by just trying to get the tartar off. So we have to make a real careful judgment call about doing that. My concern with the anesthesia free, and I hear this a lot in the holistic community, that, well, I don't want to do the anesthesia. People are afraid of the anesthesia. And I understand that. Like, I don't like when my dogs have to be anesthetized. But again, if you don't do that, you are not going to get the full exam. So relying on anesthesia-free cleanings as a substitution for doing the full exam and x-rays under general anesthesia is not a good idea. Is not a good idea. And I always recommend, when you get that procedure done, I do recommend going to a dental specialist. There's a huge difference now in the level of education in veterinarians when it comes to dental care. And when I graduated several decades ago, everybody was pretty much trained the same. There wasn't a lot of advanced training in dental care. We all sort of had the same knowledge base. So you could go to a general practitioner to get the dental care for your pet. And that, well, probably weren't even dental specialists back then. Now they've learned so much more about proper dental care, evaluating x-rays, better extraction techniques. And this is huge. So veterinary specialists will have better techniques in extracting teeth that are way less traumatic. Like, we learned, when I was in vet school, we learned you go in with a elevator and you just keep working around the tooth until it pops out. Well, now they have techniques that are way less traumatic to the jaw and to the surrounding structures. These little dogs like the Chihuahuas, when you look at their x-ray, like, they have these big tooth roots sometimes, and they only have a few millimeters of jawbone on the outside of that tooth. So their jaws can actually be broken trying to extract teeth. So that's where having an expert that really, really knows these better techniques. And I've seen a huge difference in my dogs, because they've both been in and had multiple teeth extracted, and they come home and their mouths are not inflamed. They usually have some stitches in there. They need a day to get over the anesthesia, but man, they're feeling good. They're wanting to go back to chewing on their toys and ready to eat. And they're feeling great. And that is a testament to the techniques used to extract all those teeth. So there really is a big difference, and the specialists do cost a little more money, but I feel like it's way worth it, because you're getting a proper procedure done. They're not going to miss anything, or they're less likely to miss something that's going to just cause more problems on down the road. They have a tech dedicated to monitoring the anesthesia, which improves the anesthesia safety. So that's the way I recommend going, for sure.
Well, you wouldn't go to your general practitioner, your doctor, your family doctor, and ask them to go work on your mouth.
Exactly.
To a dentist. And so now I love that the field is growing up into there, that they have special dentists for dogs, essentially.
Right. Is exactly what it is.
And they are going to do it, because the quality of life element is so important. So I have another question. Could kibble cause dental tartar buildup and all that type of stuff that's on the tooth?
Yeah, I think it definitely contributes to it. So, there's this big myth out there that's been out there for as long as I've been practicing, that dogs need to eat dry food or biscuit type treats, the milk bones. I don't know if the milk bone commercials are still out there. They used to have these commercials where the dog would be eating a milk bone and they'd have this shiny little star in on their tooth because it was cleaning the tooth. It's like cleaning your teeth with an Oreo cookie. Really, so eat an Oreo cookie and go look.
Wait a sec. That's not good.
Go look in the mirror. Right. Well, eat an Oreo cookie and go look in the mirror and see what your teeth look like. So enough said there. I think people will get the idea. So These
Right.
foods, first of all, they're high in carbohydrate, right? So high
Sugar.
in sugar,
Mhm.
high in grains, and it doesn't matter whether that it's grains or beans or peas or lentils. They're all carbs and they're all sugars. And when those foods crumble, it actually accumulates around the gum line and just starts building plaque right away. They do nothing to clean the teeth. Raw food is so much better because the meat is actually abrasive. I mean, we cook meat to make it tender. When dogs eat it raw, it actually helps scrub the teeth, literally. And if they eat, things like little, chicken necks or chicken wings or things like that, that they can crunch through that cartilage, that's a fabulous, fabulous toothbrush
Yeah,
for their
absolutely.
teeth.
So what do you think about those greeny teeth cleaners, the ones that they chew on and that type of stuff that's all basically processed?
Yeah. Don't feed your dog anything that's molded into the shape of a toothbrush and looks artificial because it
Yeah,
is.
because it is.
No, I don't like the greenies. And there's so much marketing out there, like it doesn't matter if they say that they're natural or healthy or, whatever the marketing claims are. Read the ingredients. That's what I do. I read ingredient labels all the time. I mean, constantly I'm pulling up ingredients on things, and those are all starch. They're no different than feeding the milk bones or the kibble food. They're, except for the fact that they're molded into a little toothbrush. It looks like a green toothbrush.
But it's so cute, Dr. Judy.
You know what? You know what would be better is go to the drugstore and buy a green toothbrush and brush your dog's teeth with it. That would be better.
Something I do, I started to buy raw bones, raw uncooked bones that are just from like a raw dog food supplier. And I'll throw it out for Leo in the backyard and he would just gnaw on that thing. And in the back of my mind, I'm thinking, could that be helping with him cleaning his own teeth as well, going to like a raw, hard bone?
Yeah. Now you want to be careful that, because some bones are hard enough that they can crack their teeth on them. So like the marrow bones, the weight-bearing bones of big animals like cows or bison bones, the marrow is great and they can chew on them a little bit, but if they're really chewing on them long periods of time, they can crack their teeth. Antlers are another one. There's a lot of these antler treats out there, and there's nothing wrong with the antlers nutritionally, but they're hard, and they're hard enough for dogs to actually crack their teeth on them. And then that's one of the reasons why the roots get infected, is they just have these little like micro cracks in there that are even hard to see. And all of a sudden there's an abscess tooth, and it's because the teeth got cracked. So the knuckle bones that are more cartilage, or the tendons, things like the dried tendons or bully sticks or chicken wings or necks, things like that are much better. But anything that they chew on like that, because you think they get on the side of their mouth and they're kind of gnawing on it and literally scrapes the teeth. So those are great things to do. Those can really help clean the teeth.
So keeping the sugar out of their diet will keep that plaque buildup, and the sugar is going to come from kibble. So if they're eating kibble, they're eating a heavy carbohydrate that is going to start creating that buildup over time, where you see that hard yellow plaque. I know with my previous dog, Doc, before she passed away, she would have yellow in her teeth, and we were constantly chasing it. And every time we took her to the vet, they were scraping the teeth, making them look pretty, because we didn't know better. But I know now with Leo is 7-8 years old, and his teeth still look white. And I've never taken him into the dentist, where his breath doesn't smell bad. And Leo has been fed raw his entire life. And I really feel that there is a big difference between a raw fed dog and a dog that's been fed kibble throughout its life and their dental health.
Yeah, absolutely. Absolutely makes a huge difference. Your little dogs, our little chihuahuas, their mouths are so small. They're so prone to dental disease anyway, that it's probably going to happen, even if you're feeding raw. But I also look at it that their mouths would probably be in way worse shape, or would have gotten worse, way sooner if they were eating a kibble diet. So just because the dental disease shows up, in these little dogs, it probably would be way, way worse than, if they were eating a kibble diet. And then also, they're eating raw, they're healthier. So if they do need to go under anesthesia, they're healthier and their bodies are better able to, to manage that and to handle that, because they're in good health.
Yeah. That was something they did say yesterday when they put him under anesthesia, and they had him under for a long time. They kept remarking how his heart rate was very strong, how he was very healthy. And they looked at him and saying, this is an extremely healthy dog, being 16 years old that he is. And, how many of us, start writing dogs off at the age of 13, where we're like, well, they're old. Well, he's 16 and he's still, cardiovascularly and health-wise, the vets were very happy of his condition, and they felt that he was going to bounce back really quick after doing this really extensive surgery on his mouth to get out all the infection.
And age is not necessarily a reason to not anesthetize your dog and tend to some of these health needs. I mean, yes, it's important to evaluate them. You want to make sure they have a healthy heart, and you would do some blood work on them, make sure everything is functioning okay. But, when dogs, I have clients, that come in and see me, and their dogs will be like 8 or 9 years old. And they say, everybody thinks my dog is old. Like, that's not old. Dogs are living shorter and shorter lifespans because of the poor diets and over vaccinating and too many pharmaceuticals and all these things that we talk about on the show. But when a dog is fed raw and not over vaccinated, allowed to live a healthy lifestyle, especially these little dogs, 15, 16, 18, they can live a long time.
No, if it's up to my wife, he'll live to be in like 35, 40. Yeah.
Hopefully your marriage survives that.
Yes, absolutely. I'm so happy that we had this show to talk about this. So what do you think is the number one thing that we should be aware of with our pets? So as anybody that's after this show, they're thinking of their dog and they're going to go check their teeth, what should they be aware of, or what should their concerns lean towards?
Well, if they're going to be looking at the teeth, they want to look for, like you were saying, discoloration, mouth odor, pain, any of those things. They should get their dog in and get them checked. They should be on a fresh food diet, ideally raw. If not raw, there's some dehydrated, freeze-dried products out there if for whatever reason raw doesn't work. But off of the kibble and off of the biscuit type treats. Those are just like giving your dog a candy bar. Get some good jerky treats and healthy things for them to chew on, like the bully sticks and the tendons. Brush the teeth. Good old fashioned, get in the mouth with a toothbrush, as long as your dog doesn't bite you when you try to do that. Have to put that in for Matt.
yeah. I need that.
Get a very long toothbrush
really long one. I might get the guts someday.
For Mr. Cha-Cha. And just some good old coconut oil. People ask all the time, what do I brush my dog's teeth with? Coconut oil is a great anti-inflammatory, it's antibacterial, and dogs like it. So it makes the process, a little more pleasant for them because they at least like the taste of it. Most every pet toothpaste I've seen has all kinds of artificial flavors and colors. I've seen artificial sweeteners, just a lot of stuff that your dog doesn't need. Just use some good old coconut oil and get in there and brush the teeth. And I would say, make sure that you are getting the teeth checked. And I think by the time, a dog is middle-aged, probably getting him in for a dental procedure, getting the x-rays done is a good idea, especially the little dogs, because they really are prone to more dental disease.
Yeah. And we don't want our dogs to suffer, even though they can't tell us, they can't talk to us. we've got to be their advocate for them. So thank you, Dr. Judy, for this week's show. This is awesome. I love the wisdom that you gave us all.
Oh, well, thank you. It's my pleasure. And, the bottom line is, improving our pets' quality of life. I don't want to think about pets running around with painful mouths, because I know how much that hurts. And I know with my own dogs, I look in dogs' mouths all the time, and I've taken them in for their dental procedures, and they've had way more teeth that were diseased than I ever would have thought. So it really is important to get them in, because your pet could be suffering with pain that can be remedied by one of these procedures.
Yeah, absolutely. If you want to get in touch with Dr. Judy, just have a teleconsult or actually become a new patient of hers, you can contact Dr. Judy at ahavet.com. And she's absolutely fantastic. She's my vet, and I don't know what I did before I had Dr. Judy in my life for my dogs. So if you want to contact us at ParsleyPet, we can test nutritional deficiency. We can test nutritional deficiency inside your dog, 48 different nutrients. So you make sure that you're feeding your dog a healthy, complete diet. And you can find more about us at ParsleyPet.com. Also, in the show notes down below, you will find and you will see Dr. Judy's website and our website as well. So definitely come check us out. It is definitely worth every minute. And I want to make sure that your dog is happy and healthy and lives this incredible life that I know it can.
Yeah, absolutely. And also on my website, we have a resources page. There are some recommendations for referrals to dental specialists if you're in the Denver area, FYI.
Awesome. Thank you, Dr. Judy, so much for this show.
Thanks, Matt. Have a good one.
All right. We'll talk to you soon.
Okay. Bye.